thank on behalf of the Ministry of Health, the World Health Organization, and also other UN agencies for their immense contribution over a long period of time to uplift the Sri Lankan healthcare standards to today's level. Their support, because of their support and also because of the unwavering commitment of the healthcare professionals of the country, as WHO also highlights, our care has come to the world level, and WHO recognizes Sri Lanka as a country which provides better quality healthcare at affordable and lower costs. Something remarkable. So as the Minister of Health, we've seen and the Sri Lankan people have witnessed, in parallel to the free education of the country, free health sector was developed during last 75 years since we gained independence from the Britishers. There are so many factors and also there are so many facets of that development, and we have known that at the time of gaining independence from Britishers, our life expectancy at birth was mere 42 years. It has come up to 77 years now, but there are other countries regionally and globally who are doing better than us now. And also our statistics, the main areas of maternal mortality, infant mortality, and also other conditions like vaccine-preventable diseases have come up to world level. Yet, we are facing new challenges in the third decade of the 21st century. Firstly, because of the fact that we were experiencing some hardships during time of COVID pandemic, which was followed by economic recession and the debacle which we experienced last year. So our care has been plateaued for last 2 to 3 years, unfortunately, but I'm quite confident with the support of the multilateral support from WHO and also from the other organizations, and also with the able set of professionals who are handling this subject, and also with the strong infrastructure that we have developed, we should be able to uplift the Sri Lankan healthcare standards to the next levels in time to come. New challenges that we face include malnutrition of the children, which have become serious concern since of late, and also our professionals have been migrating, they were looking for the greener pastures and they were migrating. And also, as highlighted by Dr. Mahipala, we are burdened with high level of non-communicable disease segment, and everywhere we see a lot of patients with neoplasms, hypertension, diabetes, cerebrovascular accidents, other events including dementia and so on and so forth, which need a lot of attention and which would cost a lot of money from the government coffers. So also, we've been encountering a lot of issues since we started our work at the Health Ministry, especially in relation to providing good quality medical products to the Sri Lankan people on an uninterrupted basis. We have seen a lot of support extended from different quarters. We welcome all that support. Hopefully, we should be able to put things in right within a short period of time. I have seen from your listings and the deliberations, today's event will cover a lot of subjects in relation to fast-changing demographics of the country, and we are burdened with, it's a blessing in a way, but it's a serious concern health-wise that our demographics are changing fast, and we will be having a very serious issues covering the higher level of elderly population in the country. As per the statistics, by 2037, nearly 25% of the population of us will be falling into a category of elderly population, and also we have a 75% dependency rate by then. So it's a multifaceted approach that need to be implemented top down and bottom up, and from the ministry's level, starting from policy decision, we want to ensure that we address all the sectors simultaneously, effectively and efficiently. We know that it's become a burden to the families. We need to strengthen them. We need to provide the family support. And also there are different organizations at the village level. We have to ensure that we cooperate with the other government sector organizations and also NGOs and INGOs to provide that care. And also we need to build the capacity of the healthcare workers to ensure that they are provided with necessary infrastructure and also necessary educational material to ensure that they go ahead with the support for the elderly population of the country. And I'm quite confident that Dr. Malitha Mahipala is there with a lot of experience in the World Health Organization and also a lot of experience in the Sri Lankan healthcare system. We've been supported with a lot of other professionals in the country, in the ministry and otherwise, and also not forgetting all the support that WHO has extended to the Sri Lankan people to ensure that live a better life and in time to come. So I thank again for all the organizers of this event, and also I thank on behalf of the Ministry of Health, World Health Organization, and everyone who had come forward to support Sri Lankan healthcare people. I think together we should be able to provide better life for the Sri Lankan people in time to come. So thank you very much and have a good day.
Universal health coverage is a concept which has come forward long years back in Germany. That was in mid-19th century, where they were talking about provision of care to the entire population to healthcare insurance. But then it has come forward as a concept later. I think all of you are fully aware what does it mean by universal health coverage. UHC is nothing but provision of comprehensive and quality healthcare services, which include promotive, preventive, curative, palliative, and rehabilitative care, which has a great access to the people. So there are two main dimensions we are talking about. One is the quality dimension, and the other one is the coverage or access. And if you look at the global figures, at the moment, 4.5 billion, which close to 50% or even above 50% of the global population, does not have access to the essential healthcare services. And then 2 billion people have difficulties in financial protection. And of course, 1 billion people do not have access, and they are suffering from severe hardships financially in getting the essential healthcare services. So therefore, it's very important in Sri Lanka. I think we have free healthcare services started from 1931. There was a use of fee introduced to the healthcare system before that, during the British time, and people and public had a huge cry and fighting for free health and free education. There was a commission appointed by the governor, headed by Lord Donomo. We call it Donomo Commission, which recommended free healthcare services and free education. That was started from 1931. So we had free education and free healthcare services across the country from 1931. And today, as a result of this state of welfare decision taken at that time, we are seeing the benefits and dividends. And it's great interest if you look at back how the primary health care to universal health coverage has been developed in Sri Lanka. Now earlier, we had Rockefeller Foundation, were supported to have an intervention to address the helminth infections. And they have supported with $1 million in 1918, then 1919, 1920, but have not seen any impact. Every year you have seen it's more and more. So then it was thought that there should be some other intervention focused on community. So there was a committee appointed who recommended the primary health care unit system. So Sri Lanka is fortunate to have the primary health care services established way back in 1926 as the first such intervention in the entire globe. And today, UHC is through the primary health care services. That's how we can have access. But primary health care services does not mean that it's a low health care delivery. Primary health care services mean quality, comprehensive, patient-centered health care services. That is the mean of achieving universal health coverage. We have had reforms of primary health care. We know that there was some changes we have seen. We have seen the epidemiological transition over the last 2-3 decades. We have seen the demographic transition, so we have elderly population. Instead of communicable diseases, we have non-communicable diseases. And also we have seen the lifestyle transition and economic transition as well. So as a result, we have more non-communicable diseases today, and it's a major reason for the mortality, and 80% of the mortality is due to NCDs. Elderly care is another area. So we need to integrate all these services to the primary health care to deliver integrated comprehensive healthcare services, for which we had the reform and came out with, I think, 2019, 2020. There had been wider consultation, and came out with the universal health coverage benefit package for Sri Lanka. But still, I think we have lacking certain areas like palliative care and rehabilitative care for disabilities. So therefore, we need to include these things, and this is the high time when we commemorate the Universal Health Coverage Day that we need to talk about primary health care. There's no other way. If you want to reach and improve the access, the primary health care is the way forward, and that is globally accepted. And from Alma-Ata Conference in 1978 to 2018 Astana Declaration, we were focusing on primary health care. And now the UN General Assembly has taken up this with the head of the states and get the commitment from the head of states to focus much on primary health care and universal health coverage. If you look at the USC index, Sri Lanka is not doing that well. We have wonderful primary health care setup. In 1990s, Dr. Saroj has written so much of books on history of primary health care development in the country, and it was said if somebody walked 3 kilometers, he can find a primary health care institution. If somebody walked 4 kilometers, he can find a school. But still, if you look at the USC index, it's 67, and global average is 68%. Global best is 85% in Japan, Norway, and other countries. Even Thailand, where we have better indicators than Thailand if you compare the public health indicators, but still we are lacking. So therefore, I think we need to really focus on NCD care, and that is where we are lacking. We have so many millions of people have hypertension. We screen them, but our control measures are not good. They are not under control. Then diabetes, and then of course other care. So we need to really focus on healthy lifestyle centers, well-women clinics, and delivering quality comprehensive primary health care services. I don't want to take much of your time off, but still as senior professors are here, we have SLMA president is here, and there are other colleges and our health ministry senior officials are here. I think we need to really focus much on primary health care as a way forward and to have high coverage and improve the USC index. So we have a wonderful minister who understands everything, who is a doctor from our fraternity. So I think this is the high time that we can start to deliver, start consultation, and continue with the conversation and see that how best we can reform our primary health care system to achieve universal health coverage. With that note, let me thank Alaka, and I also have worked for WHO for 7 years. So I know the spirit of WHO, focusing so much on primary health care. So I am sure that Alaka and the team will focus much and work very closely with the Ministry of Health under the guidance of Honorable Minister. So I'll stop here and hope that we will achieve the UHC index a very high level, at least go beyond 80% within next 3-4 years. I'll stop here. Thank you so much.